Hello, this is Stephen Holloway. We're going to talk about completing your comprehensive adult assessment using SimChart. When you log into your SimChart, you will basically go to My Clinicals, and under My Clinicals you will see the Adult Comprehensive Assessment. This is where you'll go to complete your assessment. Today I'm going to be using my SimChart practice assignment case study. So as you get there, you're going to see basically what you need to enter. Of course, the date of the clinicals, we're going to go ahead and just put it for Friday, 7 November. Patient identifier will be their first initial, their last initial. Then you'll select, was it a med-surg, pediatric, psychiatric, women's health. Okay, was your patient a male or a female? Age, 71. You do have to create an avatar, which I think is neither here nor there, but you must do that. Then your provider initial, just if you will go ahead and just put my initials in there, SH. That's all you really need to know. I'm not really worried about the provider type process. And then here you'll put your initial, first initial, and your last name. Credentials will just be NS Nursing Student. Now remember, you must save this information to move on. So credentials, we're just going to put, I'm going to put, for me, RN. For you, it'll be NS Nursing Student. Okay. Go ahead and hit save, and it says saved. OK. It's going to take you over to a new area. What I want you to do is when you get here is get to your preclinical manager. Preclinical manager. And then let's take a look at basically what diagnosis. So we're into the add diagnosis. So let's say our patient has congestive heart failure. You can go down, you can type it in. Well, sometimes this is, let's go up here. Let's click here. So here's heart failure. We'll type in heart failure, and this is the primary diagnosis for the patient. Here's where you will do basically your path sheet for me. What is the pathophysiology that goes on with that patient? Now you've got some interesting type processes to do. You have resources that are here. Do you want to save changes? We'll hit yes, because then that will keep it there. We can still add, we can go back to that and add to it, but we can go down to resources, and here are all our different resources: Mosby Nursing Consultant, CDC, CUSIN, Joint Commission, a lot of different areas that you can put from. So we could go to Mosby's Nursing Consult, and basically then we can search for heart failure. And there's heart failure, and hit go. And then you can basically go from those type things. Results, here's hypertension's a problem, those type things. So you can look at several different things: evidence-based nursing, drug updates, books. Let's look at books, and then it'll give you something: pediatric, Sheehy's, Manual of Medical Clinical Surgery, Mosby's Clinical Nursing. Let's go there. And then it's going to talk about congestive heart failure. And you can pull from any of these to do your path sheet for me. Now, I don't want you to just copy paste. You can use several. It doesn't matter, but tailor it to your patient. Maybe your patient is in with right heart failure versus left heart failure, or left heart failure, or maybe basically you've given a class of the heart failure. All of those would be what you would want to go back to. So basically, we're going to go back to our preclinical manager. We're going to go back to our diagnosis. Okay, and we're going to put heart failure, and then down here you would just say left-sided. Well, here we go. Come on. I'm typing and it's not doing anything. Oh, Got to click edit. I forget. I'm learning too, guys. Left-sided heart failure. And then talk to me, basically about left-sided heart failure. What is left-sided heart failure? How do you manage, what causes it? And then maybe you may know what it is. It's maybe related to long-term hypertension. But basically, heart failure is failure of the pump to do, which leads to those type things. Okay, therapeutic regimen, what are they doing? Maybe this patient is on diuretics. Maybe they're on different types of things for heart failure. And what other kind of health problems is it causing for this patient? Those are kind of what you're looking for. So therapeutic, he's on diuretics. Diuretics and inotropic agents. Okay. Other health problems: shortness of breath, decreased activities, inability. Again, my typing. Ability to complete ADLs. All of that could be there for that patient. But again, I expect you to be a little bit more specific. I don't have time to type all this in. So you're going to hit save. And it's going to be updated. Now, if you want to add another diagnosis, you could come in here. Secondary diagnosis could be hypertension. You would go on from there and talk to me about what is hypertension, what are they doing for his hypertension, what are the health problems is it causing from that point of view. So we're going. I want to cancel that hypertension, so we hit OK. I hope I didn't cancel out of the whole thing here. If we did, you will learn something from it. Okay, so there. So we've got that in. Next thing are medications. Now, select a new medication. So this patient is on, let's say, furosemide. Okay, so you've got several different furosemides. Well, this person is getting IV furosemide or IV Lasix, so we want to go there. So classification, and you would need to know what basically this is, and you could just type that in, loop diuretic. Okay, and how's it being given? It's being given by an IV infusion for this patient. Dosage, let's say he's getting let's say he's getting 10 milligrams. Frequency, hourly, date ordered, whatever date it was ordered. We were here on the 7th, we say. Okay, comments, okay, and additional medication info. So this would be kind of where we talk about your nursing. You've got nursing interventions that go along with this patient. So how does this work? What are your actions? Again, the good thing is you've got your here resources you can go to, and remember to save your changes. Okay, so we can go to our resources, and we go to clinical pharmacology, and we just go quick reference guides or contents. That's not really what we want. Okay, so let's find reports, list, patient education, resource center. Let's just search Lasix. Go. Okay, So all of those are tablets. You could go on and look and see if there's something IV. Here's basically talks about IV medications. So IV for solutions. And then it talks about what should it tell, what this is patient teaching here. So you would go back and just search. You can play with that and search. But basically this is where you're going to be completing your medication administration type process. Now don't just go in here and copy and paste all this information. You really want to look at some of those types of information. All right, let's go back to our SimChart. I'm just going to look and see what else they had for you as far as that. Last time I did that, I got better information from this. Let's try the nursing consult and see. References. Let's go drugs. I think on the nursing consult, I think that's going to be a better thing. Search for Lasix. And go. Okay. So you can search through and see what is there as far as those type things that are for you. I still thought there was more here for you, and when I did it before, quick current updates. But you can see adverse reactions, IV compatibility, drug interaction reports, classifications, lists, monographs, different things, patient education resource center, lab reference values. All of those are there as far as the clinical pharmacology that goes for that patient. Content updates, I'm not sure what's under there. It's updates on new things on medications, which is good. So you can kind of look at all of this information to see what you would want and pull that together for your medication sheet, your drug information sheet. But that's where we would want that information. So we could go back to our Lasix and we could go there, actions, works by, comments, additionals, medications, nursing interventions down here, recommended dosages and ranges. You put in here nursing interventions would be things like monitor potassium levels, continuous infusion, must be covered to protect from light. Those would be some of the different type things I would expect you to put in those nursing interventions. Monitor the potassium levels. Talk to me about what kind of information you would need to know to monitor potassium levels other than labs. What would you teach the patient? Recommended dosage and ranges, contraindications of using that medications, the therapeutic effects. This is basically what you have as far as your drug information sheet already. So this is all the same stuff you've been doing. You're just typing it in for those areas. Laboratory tests, it's kind of the same thing. You'll go in and you'll select, you could go blood tests, you could go CBC, hit enter, cancel. So let's just say, and then describe what it is and the significance of this, definition and description, the date of the test, maybe it was done on the 6th, and then come over here. There's a couple of different ways we can do this, and I think the easiest way is, if there's an abnormality, give me the ranges in the abnormality and then what that means for your patient. So you could say, the RBCs equals, give me a number, hematocrit equals, give me the number, hemoglobin equals, give me the number, and then go down, indicates anemia related to chronic kidney disease. Okay, something like that would be what I would be expecting in there. Same thing if you go back and hit blood test. We could do blood tests. We could go down to, let's just hit save there. And again, I'm just going to type in CBC, and I'm okay with that, and then hit save. And I'll be honest with you, I'm not sure why it's not saving it for me. But you go through, you have the idea where we need to go from there. Same thing with the diagnostic test. Go in here and select, let's say, ultrasound, and then you can go from there. And let's say we did a echocardiography, 3-color Doppler on this patient. What does that mean? Why was it ordered for this patient? And the significance, basically what are the findings and what's the significance of those findings for that type patient. Hit save. Oh, got to select the test date and hit save. Okay, and all of that information is in there for you. Once you get all of that put in, then I want you to go back up basically to patient charting. Actually go to summary. Let me back up. Let me look at my notes. Okay, did the patient charting. We're going to go to patient charting instead of summary. I do want you to do the admission history. Go through admission data, health history, allergy information, home medication information. This is just like doing an admission assessment on a patient coming in the system. If you know the immunizations, put those in. Drug screen, don't really care if you do drug screen, but I do want you to look at smoking and alcohol screening. Go ahead, do a fall risk assessment, do a psychosocial screening, do a nutritional screening, then go over cultural spirituality, bed sore risk, Braden scale, which is part of that, pain management, and unit orientation information as far as doing the admission history. Then I want you to do the systems assessment. Do symptom analysis. Then skip the complete physical assessment head to toe, because that's what you're going to do as you do your cardiovascular assessment, your respiratory assessment, your neurological, integumentary, sensory, musculoskeletal, GI. And this is just what you're already doing in the comprehensive assessment. Let's just click on the cardiovascular. Basically, apical pulse was regular, murmurs, no murmurs noted. But let's say you clicked on murmur, and it's going to give you basically a breakdown. Was it faint? Was it soft? Was it loud, palpable with a thrill? Loud with a thrill, heard with stethoscope. And this goes back to your rating of murmurs from basically 1 to 6 on the murmur. Then your pulses, basically was it 4 plus? Those would be the things that you're looking for on your patient. And you would just go through 2 plus. Maybe 2 plus, and maybe you get down here and it's only 1 plus. All or maybe you get over this leg and then it's not palpable, but you use, and see, 1+ tells you notify a healthcare provider. Doppler used on that area. Okay, and then you would go over to the next one, 1+. Okay, and Doppler used on those areas. So as you go back through and you hover over it, it tells you, basically it will give you a breakdown of where you were, what you've done for these patients already as you look at those. Here where you put your vital signs in, tissue perfusion, any edema. I don't really care anything about the calculated ankle, brachial, index type processes, but I do want the capillary refills, the peripheral perfusion, the edema, cardiac assessment, any notes you need to put there, edema notes you put there. The main thing on the edema notes is how far, especially lower extremity edema. How far does it go up? Does it go to midway to the knee? Does it go all the way to the knee? All of those. If the patient's on telemetry, yes, no. What kind of rhythm are they in? Cardiac problems noted. All of those go into that area as you do those. Make sure you hit save after each one and hit OK. And that's how you're going to go through those type issues. Now, basically, that's your systems assessment on that patient. Do go ahead and do discharge planning. It just basically talks you through what you would be doing for the discharge planning. I do not care about a discharge summary. Systems nursing interventions you need to do. These are interventions you're doing for your patient. You may not have an intervention for all of these, but if you have a cardiovascular patient, what did you do for that patient? Are they on telemetry? Are they on a cardiac monitor? Do they have drains? Patient responses to these. If you're doing something for them, make sure you're marking that. So make sure you go through these as you do it. Special charts or basic nursing care is next. These are just your hygiene, your safety. That shouldn't take you long to complete that. Special charts, really what I want you to look for on special charts are your S-bar and then anything that would go along with your patient. If your patient's in restraints, do that. If your patient had a PCA, do those. If you gave pain medication, talk about the pain scales on that patient. Only do what's appropriate to your patient at that point in time. Same thing with the wounds. If your patient had a surgical incision, mark it there and then talk about what's going on at that point in time. Same thing for drains and tubes. You could go here, go back to there. What kind of drain do they have in place? Those type things. If they have an ostomy, if they had an ostomy, then you would mark those areas where the ostomy is located. Don't really care anything about ejection sites. Vital signs I do want you to put in for that patient. Then drop all the way down to basically patient teaching. We're not going to be doing the MAR. You're already going to have talked to me about the medications and the med sheets that you're doing. So we're not going to worry about the MAR for this part. Next thing I would want you to do is the care plan, and this is where you'll do those your care plan and list for me those 10 nursing diagnoses and follow through with that. So you don't have to write all those out. So you finish all of that up for me. Basically, at that point you are finished with your patient. You will have done an initial assessment, a history. Let's go back up to patient charting. So you will have done the admission history, which will be the admission data type process, and then the health history is part of what you're doing already. It's just a checklist that you go through. Very, very easy to use, just going through the checklist. So that does your history, all of this information. Then when you do your systems assessment, that's your physical for your patient, and then the other basic type processes you will do. I know it's going to take you a little while to do this when you first do it, and we appreciate you guys being the ones to start with us and help us do that. It's also going to take me a little while to grade these, so be patient with me as I try to get these graded for you. If you have questions, please send me an email. I will get back with you as soon as I possibly can. Hopefully this has helped with this as you sit down and try to go through it. I didn't have time to go through each section for you, but if you have problems, need to come see me and sit down and work with it, I'll be glad to work with you on those. Have a good evening, and I will look forward to grading your papers.